a very good afternoon to all of those who are joining me live on the Facebook page of News9. I'm Neha, and today we will be discussing about, in fact, I'd like to begin with a very important question, and the question is, are Bengaluru hospitals facing shortage of oxygen supply? So what exactly happened and why am I asking this? In a shocking development, and I'm quite sure that all of you are aware of it, from the city, of course, KIMS Hospital in Bengaluru ran out of oxygen, following which over 23 patients were shifted to other hospitals in the city due to the delay in supply of oxygen cylinders to KIMS Hospital. The COVID positive patients have been shifted to, in fact, were shifted to Victoria and Bowring hospitals. Total of 350 patients are admitted at KIMS Hospital, out of which 100 needed oxygen support and 47 are said to be serious. So apparently about 150 patients continue to receive treatment at KIMS. And as you all know, the demand for oxygen has tripled due to coronavirus outbreak. As per reports, there in fact has been no supply of oxygen or minimal supply of oxygen from Universal Gas Agency for past 2 days. Even the agencies are said to be suffering from shortage of oxygen supply. A total of 45 ambulances were reportedly rushed to KIMS to transfer the patients. Out of 350, 23 were shifted to different hospitals. Now this is touted as the biggest ever medical failure by the Karnataka government. Majority of the patients were shifted to various government hospitals, as I already mentioned, like Victoria and Bowring. Now, it is to be noted that demand for oxygen has tripled in the country due to the soaring coronavirus cases. The suppliers have been running out of their stock for the past 2 days, and there has been no oxygen supply from the Universal Gas Agency, or in this case, minimal oxygen supply. Do remember that in the month of June, the WHO, World Health Organization, had sounded alarm that there will be shortage of oxygen due to rise in coronavirus cases. We will do an in-depth analysis as Dr. C.N. Manjunath, who's also a task force member, joins me over the phone line. Thank you so very much, Dr. Manjunath, first of all, for being with us here today. The question, first of all, sir, is what led to the oxygen shortage?
See, what is happening, if 100 people are getting tested positive for COVID-19, maybe 8 to 10% might require this oxygen. See, one of the unique feature of this treating this COVID-19 patient, they require a high flow nasal oxygen system. Normally, whenever a patient is having low oxygen saturation in a non-COVID patient, the oxygen requirement is in the range of, say, about 3 to 4 liters per minute, 3 to 4 liters, okay? That is the rate of delivery of oxygen. For these COVID-19 patients, particularly when their saturation is below 90, then going down further, they require a very high flow, as high as 30 liters per minute, maybe even 50 liters per minute. People have given up to that volume. Such a huge quantity of oxygen is given to some of these patients. As a result, there are some, these oxygen cylinders are getting emptied faster, and now we have what is called liquid oxygen system also, where it is, available as a liquid concentrate. Then when it gets into the system, because exposed to some temperature, it becomes a gas. So I think we have two types of system. One is available as a pure gas. Other one is in the liquid form that becomes a gas. Both the types are available, but only issue is there is demand is terribly increased. Demand has increased.
But sir, I completely understand your point, but why was there a shortage all of a sudden? How is it even possible? Do these hospitals not make sure that they have the backup?
Yeah, particularly the hospital you are referring, there was some sort of a communication gap. That's what I came to know. They have placed orders with the contractor. He has not supplied on time. That's what also I read it in the newspaper. But yes, I fully agree with you. Oxygen is such a sensitive thing. It is a life-saving thing. One has to ensure that previous 24 hours only we should, because the system how it works means this oxygen. Every day the levels will be made known. Every day, by the end of the day, the oxygen levels in the how many cylinders one hospital has got, and what is the capacity of the liquid oxygen system. So that is a daily event that has to be monitored very closely. So that is how. So, but only problem is I don't think there is a short supply, but there is a demand. Demand has increased, and linearly, accordingly, the supply also has increased.
Right.
Even that's what probably
Right.
they
Dr.
are.
Manjunath, so you're saying that demand for oxygen has soared due to the rising cases, and which is obvious. But so are the companies not able to supply?
Yeah, they are trying. In fact, we are talking to them because to our own Jaideva hospital, we conduct daily so many open heart surgeries, and we have nearly 200 bedded ICU. So we are following very meticulously. In fact, yesterday there was a delay of about 30 minutes for the transport. Of course, we had enough stock; that was not an issue. But they are because there are only two big agencies which are supplying oxygen. One is Universal Gas, as you are mentioning. The second one is Proxair. So they are telling we are working overtime to make a supply, and we are trying our best because there is. It's only because these are the two major sources of supply of oxygen. And also, everybody has requested them to enhance their capacity as fast as possible.
All right, Dr. Manjunath, as we are speaking right now, the numbers also are rising exponentially with each passing day, and the numbers of cases is only expected to rise. So how will the state government ensure this doesn't happen again?
Yeah, actually, see, number of cases are going up truly because the number of testing also has gone exponentially high. Because we are testing daily about 50 to 55,000, tests daily. So obviously, definitely there will be more number of cases. But problem is now the high flow oxygen system has been established even in district places. See, Bangalore somehow it can be managed, but most important focus now should be on district places, far off places like Bellary, Belgaum, or Bagalkot, or even Mysore. There we are getting more number of cases. So government has taken measures and steps and they've already installed high flow oxygen system there also, so that there should not be any issues. But I fully agree with your earlier introduction that there is a huge demand and there is a supply demand mismatch at this level of point. But they are telling they are going to match because what government can do is they have to place orders, and that part is nicely taken care of. There is no delay in paying money towards the suppliers and all. That is not. Now the suppliers have to ramp up the production, and they are going to ramp up their production and scale up
So doctor,
supply.
Coming back to the KIMS hospital part, don't you think, or is it not an administrative failure on part of the hospital?
Yeah, correct. Yeah, definitely they should have checked into these things. Or according
because we're talking about human lives. Even if it's one, we're talking about a life, and we should possibly do all in our might to make sure that we're able to save it.
Yeah, this is what one has to closely monitor the oxygen availability. Accordingly, we can plan admissions. Suppose a particular hospital has a short supply of oxygen, then if well in advance they can tell we have short supply of oxygen, then they can divert these patients to those places where there is adequate supply of oxygen. So that sort of an internal reallocation, redirecting of cases should happen.
All right. So, doctor, largely talking about the rest of the Bengaluru hospitals as well, what is the condition? What's the condition of Bengaluru hospitals overall?
Right now, to best of my knowledge, I think they have got an adequate supply of oxygen, okay, at this point of time. That's what I came to know.
In all the hospitals, doctor?
Yeah, all the hospital means those who are treating this
Absolutely. COVID-19, yes.
Yeah, COVID-19. So they have got an adequate supply.
But if that was the case, what happened with KIMS then?
No, that's what I think. Probably I don't know exactly what are the internal administrative aspects. So probably they should be in a position to explain those things better.
Okay, but please do tell us what's the condition of the hospitals overall. Please explain it to our viewers, sir.
No, anyway, see, because as I've already said, the high flow means See, in a normal non-COVID patient, one cylinder can suffice about 10 patients.
Okay.
But for a COVID patient, even 5 cylinders are required for one patient only. So not everybody, particularly those where saturation goes below 90, below 85. And if the saturation is between 90 to 95, they require a very small quantity of oxygen, maybe 2 to 3 liters per minute. So only for very critically sick patients we require. So one should not be under the impression that all COVID cases require a high flow oxygen. It's only 5 to 8% of COVID-19 patients require oxygen, and another 90% they don't require oxygen. They require just some simple medication, or sometimes without any treatment also they get well.
All right. Thank you so very much, Dr. Manjunath. That was indeed, in fact, a very interactive session with you. Well, that's all I have on this Facebook Live. I really hope that this information was helpful for all of you. Do not forget to subscribe News9 YouTube, like us on News9 Instagram, Facebook, as well as Twitter if at all you found this helpful. Thank you very much for joining me. Take care of yourself. Stay safe.